Hello, good evening. This is Dr. Jose Marcano from Orlando, Florida. Tonight, we're going to be doing our webinar, the Atraumatic Extractions and Drill-Free Technology, the Magnetic Mallet. I wanted to welcome you all. I appreciate you taking the time to be here tonight with us, talking about this great technology. Let me talk a little bit about myself. Again, my name is Dr. Jose Marcano. I'm a general dentist in private practice in Orlando, Florida. Been practicing for 31 years. My practice is geared towards implants. I am the clinical director for a company in California called Biodent Inc., the makers of the Ultratooth, the only immediate load certified by the FDA implant in the market, the only FDA clear implant available in the United States that can take an immediate load. I lectured for many other companies before. I'm a legacy BioLace user, lectured for BioLace for many years using their erbium chromium YSGG I plus laser. As I said before, I work with implants. I'm originally from San Juan, Puerto Rico. Been living in Orlando, Florida for 31 years and about 10 years in Philadelphia. So I've been here for a little while. I went to school at the University of Pennsylvania, School of Dental Medicine in Philly. And that's enough about myself. I'm really excited today to talk to you all about, the magnetic mallet. How do you do atraumatic extractions and drill-free implantology? So, as you can see in the screen here, we have the magnetic mallet. It is a great device. For me, it has changed my practice. For me, the magnetic mallet is as good as an invention as the handpiece, the air-driven handpiece to dentistry. Because for a dentist who places between 1,000 and 1,500 implants a year, like me, I do a lot of extractions, and I want to go ahead and preserve the bone as much as I can. And basically, this device has helped me so much with my extractions. It is a great technology made by Osseotouch, a company from Italy that fabricates and manufactures the magnetic mallet. It is called magnetodynamic technology. Okay, the use of this technology for extractions. It is definitely a drill-free instrument. It is used for several things that we're going to be touching today. We're going to be talking about, again, doing atraumatic extractions, and also I'm going to be talking about atraumatic drill-free implant placement, which is something that I'm really excited about. So what's new about it? It's very easy to set up. It doesn't have that many parts. It has, as you will see on setup video that I created, it has a pedal, a handpiece, and some tips. That's it. And you have 4 different settings for the force that you're going to use. The 4 levels of force. You have 1 as the lowest level. You have 2, 3, and 4. You have a wide range of instruments. You have the instruments used for extractions that are shaped like an elevator. You also have the osteotomes that can be used for creating an osteotomy, drill-free osteotomy, and also you can use it for ridge split. You can use it for sinus bumps, etc. It's very easy to use device. It has 2 magnets. It creates a time of impact of 50 milliseconds. These values are not changeable, so the impact is always the same. You can change the intensity of the impact, but the time of impact remains the same. You can deliver up to 1,000 pounds per square inch. It's a very, very strong device that, even though it's strong, it preserves the bone and it doesn't break alveolar bone when you're doing your extractions. It can accelerate up to 5,000 G. And by using electricity to run through these 2 magnets, the magnets oppose, and then they drive the tip of the mallet to create its force that assists you on doing the extractions. The shock weight that is created by the mallet, it's limited to approximately 5 millimeters from the treated area. Uh, Due to the minimal time of impact, there's going to be zero force dispersion, and it's very comfortable for the patient. It is very conservative, so you're not going to take away more bone than you need when you're doing your extraction. And as a dentist who places a lot of implants, I'm always concerned about taking too much bone away when I'm doing an extraction. So it's very conservative. It gives you great visibility. We're going to go over why it gives you great visibility. You have total control over it. You can use it at a low level, you can use it at a high level, and exactly where you point it, so directionality, is where that impact is going to go. So if you have great visibility, you see where you're placing it, you see where you're aiming um, the the mallet, you're going to be able to get the mallet between alveolar bone and the tooth and actually break that ligament and get that tooth out. Also, it creates no heat whatsoever. Why is it conservative? Well, it shapes, repositions, models, and condenses the bone. It never removes the bone tissue nor damages the soft tissues. So it's not like a drill when you're placing an implant that's removing bone. You have very precise and predictable uh, usage in multiple types of surgeries, from extraction to ridge splitting. Total control for the clinician during the surgery. Uh, Handpiece is firmly held by the clinician. Time of use is limited to a few strikes for each procedure. Visibility. Irrigation is not required to obtain a clear field of view. Obvious progression of the instrument into the bone, and no heat. Very limited time of impact does not generate enough heat to require irrigation. So mechanical frictions developed in a time frame of millions of a second doesn't increase the bone's temperature. Ergonomic. For me, this is a very personal one. The ergonomics of the handpiece allows you to just use one hand if necessary. It helps clinicians like me who suffer from severe carpal tunnel syndrome after so many years by relieving the stress and forces on my hands. Sometimes when I have to do 5, 6, 7, 8, 9, 10 molar extractions that have been treated by root canal, if I had to do that with my hands without an instrument like this, I couldn't finish the day. My hands would be so numb, I would have to reschedule patients. So, for those of you who have neck problems, elbow problems, wrist problems, carpal tunnel syndrome, this is the best instrument for extractions. Uh, it allows you to precisely place the instrument, and it won't give you any fatigue. So, right now, I have created a new video for Osseotouch and for dental enterprises on how to use the magnetic mallet. I'm going to share that with you. I'm going to play the video and I'm going to be talking over it. We remove the audio. And this video shows the machine. Here I'm holding the handpiece and showing you that there's only two attachments. The attachment on the right is for the handpiece. The handpiece is autoclavable. The whole wand and the whole end of the handpiece, which is very heavy and it's very uh, anti-corrosive, can be autoclaved between every patient. You also have the pedal attachment on the left, and then you have the dial in the middle that allows you to control the force. On the right, you can see the different tips that are used for extractions. In this demonstration, I'm using a tip that I usually use for posterior extractions. I put the circular nut on it and then tighten it over the magnetic mallet. And right now you can see that I am stepping on it and the mallet is actually firing itself. We don't have any audio of that, but you can trust me, I'm stepping on the pedal on this one. Um, those are the posterior tips. I'm going to go over the tips in a little bit. Here's the mallet itself without any of the attachments. As you can see, the autoclavable handpiece and the pedal. So it's a very simple instrument that takes care of very complicated extractions. Here I am showing you the anterior tips for extractions and for actually for using for the wisdom teeth, or the one on the far right. Uh, Now, as you can see, the third tip that I'm touching has a concavity. That concavity is made to be shaped like the tooth so that you can position that tip basically between the tooth and the bone and drive that tip between the tooth and the bone. And it follows the concept of physics that not two objects can occupy the same uh, place at the same time. So when you put the tip there, you go ahead and displace the tooth from the bone. Uh, Here we have a picture of me using the mallet. Uh, Now I'm showing you the posterior tips. As you can see, they're what I want to call like S-shaped. And the reason why they're like that is they allow you to come in from, for example, I'm left-handed, so I'm doing an extraction on number 30. I can come in from the area of the of number 20, and then the right side of the tip, it's going to go distally, so I don't have to put the tip so far back that it's over the patient's tongue and gagging the patient. Um, as you can see, my tips have taken a beating. Maybe Barbara can take a look at that and send me some new tips my way. But anyway, uh, these tips are used on a daily basis. I have two magnetic mallets in my office. I have three operatories, so I use them all the time. They come in with this box. This box is used for sterilizing the tips, so you don't have to bag them if you don't want to. You can go ahead and put these tips like this and run them in the autoclave. You can also put the whole case in the bag and run it in the autoclave. They're very sturdy, very strong. They're really magnificent, tips. Here you can see a close-up picture of the posterior ones, and this is a quick snapshot of a video. Here are all the tips together. Also, I'm really excited to show you today. They just came in today, the Black Ruby. The Black Ruby is a tip that allows to penetrate the bone much easier than traditional osteotomes. Thanks to the geometry of the tip, it's conical at the end and then parallel. So this allows a huge benefit in implant site preparation and sinus lift. Black Ruby is treated with DLC and exclusive from Osseotouch, which reduces friction and heat production. It's turned down close to zero. So Black Ruby is the top tier tip. As you can see here, you can see them in their box. They go from thin, I organized them here from thin to wide. On the left, the anterior osteotomes, and on the right, the posterior ones. They're labeled BLK R1, 2, 3, 4, 5. Again, really thin to really wide. They have markings, and these markings are used to basically show the horizontal width and the length of the tip. Here are the anterior ones, from the very thin R1 to the thickest R5. As you can see, they fit into the mallet, and then the circular nut is placed on top of them so that they can be tightened. Very, very nice and slick tips that help you do the osteotomy for implant placement. These are for implant placement, and they have different diameters. You start with a small one, and then you keep going depending on the size of your implant. Here, this drawing, it's really important. You can see, for example, I'm going to talk to you about the BLK-R3. The entry point, it's 2 millimeters. So you probably started with an R1. You can jump to an R3. And then you have markings that are divided between 4.8 millimeters deep to 50 millimeters deep. But as you can see, then there's the width. And they're shaped like many of the implants are shaped these days. They go from narrower to wider. And you have different width. You have 3.10 millimeters, 3.33. On the BLKR4, you have 3.6, 3.83, 4.10, 4.33. So these are really good too for you to be able to place many different types of implants. It could be from a mini implant, you can go all the way to a 50 millimeter wide implant. And here we have a slide of uh, one of my surgeries using the old tips, which are, very similar. They're not as slick as the black ruby. So now if you get a mallet, you're going to get the black ruby tips, I believe. And basically, this is the way that, you would be using them to place the implant. I'll show you a video in a little bit of this in action. So let's take a look at a couple clinical cases. Here, I'm going to share with you a bicuspid extraction. This is a severely decayed bicuspid on a 25-year-old. Deep distal decay. It guarantees that this tooth is going to fracture 9 out of 10 times when using just an elevator. By using the mallet, the root was separated from the alveolar bone and the tooth came out in one piece without fracturing. If you're wondering about the pictures, I took the pictures from my drone, many of them in the Dominican Republic. It's one of my hobbies. I love photography. So, looking forward to, going back there and taking some more pictures. Here's your video. As you can see, this tooth is pretty decayed all the way to the bone. It's going to scare you a little bit in the beginning. Now, this is a tooth that if I just were going to use an elevator between number 13 and 14, I would definitely crack the tooth. So the technique here is I'm using the mallet on the palatal side of the tooth, and I'm going to be switching around from side to side, just getting the tooth loose. As you can see, I don't know if you saw the movement, there was a little buccal movement on the tooth. You may be wondering what setting to use. I usually use settings number 3 and 4, depending on how dense the bone is for extractions. And I use settings 1 and 2 more for the osteotomies and the sinus lift. So, if you ever wonder, if you are a user, which setting to use, I always start with number 3 for the extraction. And if I see that doesn't work, then I jump to number 4. So here I already got the tooth pretty loose. And yes, if you figure it out, you'll see my videos. I'm definitely very left-handed, so I'm working from the other side of the chair that you usually are working yourselves. Now the mallet facilitated that I didn't break this tooth, and I was able to get it out. And I was able also to get the mouth of my forceps deeply, apically on that, lingual palatal of that root. You can see that was a really pretty strong root, and it got separated by the mallet. So the second case that I am going to be showing you, it's the Osseotouch magnetic mallet assisted extraction. And here I'm using a laser, and then I'm going to be placing an ultra-tooth implant at the same time, and I'm going to show you how the case progressed and how it looked post-op. It's going to make a little bit of a noise, okay? This was an endodontally treated tooth that the endo failed, and the patient did not want to have it retreated, so she opted for getting an ultra tooth the same day. And basically, the whole concept here is to preserve as much bone as you can when you do the extraction, because as much bone as you can preserve is the bone where your immediate load implant it's going to be grabbing to. Um, as you can see, I'm pointing the mallet right at the long axis of the root. I'm not pointing at the other tooth. I'm just having the tip, as you can see, slide through the contour of a tooth. I pop the crown out, and now I'm trying to get the mallet, placed between the alveolar bone and the tooth itself, so that we get, um, you know, um, separation of the tooth from the PDL and hence from the bone. One of the great things, with the mallet is visibility. It really helps you see very well what you're doing. More than anything, when you're doing an osteotomy here during the extraction, you're going to get a little bit of bleeding. But when you're doing an osteotomy, you can definitely go ahead and, you know, uh, be able to see everything that you need to see. My whole purpose here is not to break the buccal plate, which if you go ahead and muscle it, it's going to happen. So basically here, what I did is I was able to preserve that buccal plate, do the extraction. You can see the cyst at the end of, the abscess at the end of the tooth. Now we're going to clean with a laser. One of the things that I like to do post the extraction is, remove epithelial tissue with the laser instead of using any mechanical. I use the laser. The laser will go ahead and literally evaporate any long junctional epithelium that would be in the area that, basically you don't want there when you place the implant. Um, Here I'm using BioLace's I plus laser. It's an erbium chromium YSUG laser with a 2780 nanometer wavelength. Uh, it's called the water lace. So it's great because you don't need any, you only need regular eye protection. You don't need any special eye protection. It's not like a diode that really can affect your eyesight at many feet. These you need to be extremely close for it to do something, some damage to you. So it's a very easy laser to use. The laser targets water, and as you can see, I went ahead and disinfected this. Here's a pre-op X-ray of that case. The day of the extraction. Here's my ultra tooth placement. As I mentioned before, the ultra tooth is it's the only FDA clear expandable implant that we have, and it is an amazing tool in my practice. As you can see, the implant expanded with the its abutment. Here's my digital scan with my Trios scanner. This is the day of the delivery. As you can see, the gingiva really counter very well. Now, this is a seed about 6 weeks after the implant placement. You can see the healing; it's so good. Um, the crown placed the day of the seat. The implant expanded with its crown, and this is a year later post-op. So, it all started with a very, very, very clean extraction, and I would have never been able to achieve such a good emergence profile saving. As you can see, the emergence profile on the crown, it's very nice. And that's because I preserved the buccal plate by not breaking it, by not using just a hand instrument, by using the magnetic mallet. Another case that we have here, clinical case number 3, a molar extraction. This one's pretty recent case. A lower right mandibular molar, number 30, will be extracted using the mallet. The mallet facilitates the extraction without a fracture. It also allows me to do this without applying too much force. The unit does the extraction for you without you hurting your hands for the next procedure. So here I'm using the posterior tip. As you can see, I'm placing it, between the PDL and the root itself. So you can see that I'm at the same time I'm elevating and getting the mesial part of the root loose. Now I'm coming from the other side and working on the distal part of the molar. The molar has been hemisected, and as you can see, it's got loose and it's ready to go. How do I know when the tooth is ready to be, extracted? Well, most of the time, what you can see on a case like this is that you'll be impacting the area with the mallet, and all of a sudden you see a little movement, a little jump on the tooth, and that means that the tooth is really getting loose. When you have the molar hemisected, you can actually, place the tip even right in the middle, and loosen some of the bone that may be left holding that tip. Uh, so the mallet is a very sturdy instrument, and basically this video that you're seeing, it's real time. This is going to take about 3 minutes to get this molar out of there. I thought I had it on a lower number. So here I'm using my forceps to get it out. Sometimes, you think the tooth is loose and it's not that loose, and it actually, doesn't come out right away. So you can go ahead and use the mallet. Sometimes it breaks if it's, an endodontically treated tooth, like just a little piece of it did right here on the video. So what I do is I go back with the mallet and I just go ahead and get it, a little bit looser. As you can see, the tooth is moving now a little bit more. The mallet has, buried itself between the bone and the tooth. So we have breaking those, ligament, uh, fibers, and the tooth is extracted nice and clean. So that's another successful extraction with the magnetic mallet. So what else can be done with the mallet? I mean, are there any other, things that can be done? Well, yeah, there's plenty of things that can be done. You can uh, place a special attachment that allows you to do crown removal. I do so many sinus lift in my office, and it's amazing. The beauty of the sinus lift is that you can go ahead and do your osteotomy without A, losing any bone, B, breaking the sinus membrane, and then doing a sinus bump. When you use the osteotomes, the black rubies that I show you, and you actually push the sinus membrane up and add some bone there, you can actually place an implant on an area that where you may have, 5 or 6 millimeters of bone. You can create a sinus bump and end up, raising that bone by 3-4 millimeters. The membrane will stay on top of that bump like this, and then basically you can place your implant, let it heal, and it will heal, and the bone will be preserved. Just because you use an instrument like the mallet, that it doesn't have a sharp edge like a drill, and you didn't break that uh, membrane. You can do ridge split. You can do, just for, heel side implant placement. You can osseodensification. You can do osseodensification, which means condensing the bone when you do the implant placement. And obviously, you can do an extraction. So now I want to go ahead and show you 100% drill-free laser and mallet assisted implant placement. Here we have a case of a 45-year-old who's missing teeth number 3 and 4. Uh, I went ahead and placed two traditional implants, two AB implants made by AB in Israel. Very, very good implants, great product. I use it in my practice for those cases that do not merit an expandable implant. So I'm going to show you the technique on basically doing 100% implant placement and soft tissue management without a drill and without a scalpel. Here we go. So basically, the first part that I do is I find the spot where I want to go ahead and be placing the implant, and I do gingival removal and scoring of the bone with my erbium chromium YSG laser, which is certified for soft and hard tissue. As you can see here, I'm using the laser to remove some of the gingiva, be sure that I am where I want to be. I definitely like this technique because what I'm doing with that um, is, you know, um, scoring the bone and making it easier for me to. So when I put the mallet and I start doing the osteotomy, the mallet stays in place, it doesn't slide out. And basically, I already have my 2 points of access. So here I'm getting the area of number 3. I already took care of number 4, and I'm using the laser. I've already used the smaller tip. Now I'm going with the next tip. I believe it's the 160, if I'm not wrong here. So basically, you can see as the mallet itself keeps inserting itself into the bone. Now, where's all that bone going that the mallet is displacing? Well, it's staying next door, it's going to the sides. And by going to the sides 360 degrees around, what I'm doing is creating a denser, stronger bone for me to place the implant. So as you can see, I'm using the mallet, rotating and tapping on it, and it's actually getting in deeper and deeper here. I believe I placed uh, a 13 millimeter long by 4.3 on number 4, and now on the molar area, I'm going to be placing a 5 by 10 millimeter wide. Uh, 5 millimeter wide by 10 long implant. As you can see in this case, I'm using the osteotome. It's going all the way towards the last marking, which I believe it's 13 millimeters from the top of the gingiva. You have 3 millimeters of soft tissue and 10 millimeters. Here we have a little bit of audio from a different angle, and you're going to be able to see how the mallet's being used. So I'm going back a little bit on the video on the procedure, and you're seeing how, it's basically, being driven into the bone, but you're seeing no bone coming out, all the bone staying in. Here's the placement of the first implant on position of tooth number 5. I was able to generate, a lot of torque here, over 40 Newton centimeters in this area. Um, the number 5 has been placed. Now I'm sorry, number 4 has been placed. Now I'm placing tooth number 3. Um, and again, the bone that it's going in is very dense bone. We're gonna get, very good results when with the placement of the implant. We're gonna get over 40 Newton centimeters. Um, and you can see here that the implants were placed. Now, what I'm going to be doing so that I can prepare the area for the very near future when I get to restore these two implants is removing the gingiva around so I can create space for the uh, the wider healing abutments. The beauty of using this laser, which is the water lace from BioLace, is that you can see that there's very little bleeding in the area. The bleeding is minimal. The implant's already placed. It's pretty deep. I put one of their healing cap just to close the implant, but I'm going to be switching it out for a wider one so that I can put a wider abutment later on and I'll have a better emergence profile. But in order to do that, you need to go ahead and open up the coronal area near the implant. And by doing so, you can place a wider healing abutment that will keep the tissue with a really nice emergence profile. So here I am placing, you know, uh, one of the healing abutments, and you can see up close how it looks. Very little bleeding, very little discomfort to the patient. So once I'm done with one, I'm going to be doing the other one. So that's the sound of the laser, removing the tissue. Uh, these tools that I'm using, like the mallet and the laser, really help the patient a lot because it's not the traditional drill. It's less invasive. It's less traumatic to the patient, and they do appreciate it. So having this technology in the office has really made it a lot easier, and it gets appreciated a lot by the patients that you can go ahead and you know do this because, for example, here, by removing the gingiva with a laser and not with a scalpel, you have no histamine release. You have very little inflammation. It's a very nice clean cut because the laser sterilizes the area around the tissue as it cuts at the same time. Um, so it is a win-win situation for the clinician and for the patient. So now the second healing abutment is being placed, and you're going to be able to see that both implants are ready. I'm going to be showing you, I believe, an X-ray of the case, and with this case, these are not immediate lows, so I'm going to let them heal for about 3 months. And in 3 months, I'll be placing abutments, taking impressions, replacing with a healing cap again, and waiting a month to get the crowns, and the case will be done. We may even do some scan bodies and get some screw retain restorations. Here you can see the placement. You can see how dense the bone is around the area, and it's a result of packing that bone with a magnetic mallet. So, make your life easier. It's the whole point of this, seminar. Make your extractions easier by using the mallet. Preserve the bone. It will allow you to, have a better site to place your implants and better surgery. So, I wanted to show you a couple of extra slides of what can be done with a mallet, and then we'll jump to questions. Again, you can see the luxation and the removal of the tooth that we talked about. Um, Here we have the mallet being used to remove a wisdom tooth. How it actually sectioned the tooth itself, and the clinician was able to take the third molar out. As you can see, the mallet can be used to hemisect the tooth and make an easier extraction. um, Here are some cases where you can see that it was used for it. um, and the osseodensification that we talked about, on that, class 3 and class 4 bone. Um, you can see some really good pictures provided by um, Osseotouch, I'm sorry, where you can see that the area was prepared with the mallet. You can see that the bone has been very densified in the area,